Today, I'm very excited to have with me one of our valued brand partners, Upspring. And with me today is a representative. Her name is Lisa Dispensa, and she's got a wealth of information to share with you and insights all about women's health, mothers, and newborn babies. So, Lisa, I would love for you to introduce yourself and share with the audience a little bit about you.
Thank you, Tina, and I'm really happy to be here with you. So my name is Lisa Dispensa. I'm a registered dietitian. I have a master's in advanced clinical nutrition. I've been working on dietary supplements for over 20 years now. My role at Upspring is medical director within nutrition sciences and really translating the science to mom, to really support mom at all stages of her journey. So it's very exciting work.
So thank you for being with us today. And I'm really excited to hear all of the innovation that you have at Upspring that you can bring to life for our healthcare practitioners and their practices. So let's talk about the health and wellness brands that are on the market today. There are so many. And the dietary supplement space is changing dramatically, especially post-COVID or while we're still in the middle of our pandemic. For healthcare practitioners, especially those that are specializing in pediatrics and obstetrics and gynecology, tell me a little bit about how Upspring is changing the health and wellness landscape. Like, what sets you apart from other brands?
Yeah, it's so important. At Upspring, we focus on innovations backed by science to help make life better for mom. And, pregnancy and lactation is such a special time where mom is so limited in what's safe for her. What can she take? And there are supplements, for example, if we're going to talk dietary supplement products that are on the market that may be safe but may not have known benefit, and vice versa. And Upspring really focuses and is very, focuses on selected ingredients, high quality, that are safe but also have known benefit. And of course, we partner with experts from around the world.
Great. Well, I know that quality is at the forefront because if I'm a healthcare practitioner, it's a sea of misinformation and hope and hype and all these things that when I'm having difficult conversations and I have a patient that comes to ask me questions about what should they be using to supplement their health and wellness, sometimes it's difficult to know which to recommend. So especially now during COVID, immune health awareness is at the forefront more than ever before. So expectant moms are looking for proactive ways to keep themselves healthy during their pregnancy and to improve their health and wellness to keep up with new baby, including, supplementing with probiotics. So the decisions of mom pre-birth can often inform the blueprint of their babies. And I think that's such a powerful thought. Can you tell me about what expectant mothers may not know about the power of immune health for themselves individually? And then also that translates to their babies.
Yeah, it's such a great question. Mom have this wonderful window of opportunity to help establish a healthy microbiome for baby and also support her immune health and her gut health. Immune markers are passed along via the placenta, and then at birth, mom, baby's acquiring mom's microbiota. So development of the immune system is really dependent on this health of the microbiome, and that's linked to long-term health. And it's really the microbiota reaches, adult type by 3 to 4 years of age. So that's pretty young. And then immune development by around 12 years of age. So it's really that early intervention is very important. And it's just this wonderful time of opportunity. So mom should feel good about that.
Well, that's fantastic. They always say that it's the gift of life, but what about the gift of immunity before they're even born? So, microbes that pass from the mother to the baby are known as the gift of immunity before they are born. So, is this a myth or is this a factual statement?
So it's really a gift that keeps on giving. Mom, in fact, is transferring those immune markers via the placenta. And this is known as passive immunity. And it really features the antibody protein IgG. So it really is a gift, and it really is a lifelong gift. And we have good science to support that.
There are significances in vaginal birth versus C-section birth. So can you talk a little bit about the difference? Because obviously moms can't sometimes control that. I had an emergency C-section myself. So what is the difference in terms of passing these microbes and health and wellness on to the baby?
Yeah, that's also a great question because there is a difference. So the C-section baby does not have the benefit of passing through the canal where they're usually, swallowing that good gut microflora from mom. But there's also transfer that takes place skin to skin contact. And of course, breastfeeding becomes even more important, right? So there's a transfer of key antibodies that are present in breast milk. We know that, and in particular, IgA. So there's even more important, there are significant differences, but even more important to breastfeed during this time.
Well, the next question I have is very near and dear to my heart. So I have an 18-year-old daughter and she has 14 food allergies. And talking about the C-section birth, and you mentioned the importance of gaining those microbes, food allergies have become so prevalent in our world today. And can you talk a little bit about how gut health and breast milk play a vital role in immune health and potential long-term health concerns?
Sure, yes, yeah. So allergic reactions really begin in the immune system, and the system is developing these antibodies that attack the allergen. And it's really amazing that breast milk creates this healthy bacterial balance for the baby's gut. And we know that a healthy gut or microbiome is key for the immune system. But if we could prevent the onset of allergies, that early onset, eczema, atopic dermatitis, potentially that would prevent the onset of other types of allergies, such as food allergies. And can you imagine, and you would know, the difference in quality of life? I mean, it would be day and night, the difference, and how that impacts the entire family, right? It's not just the baby or the child. So it's a great question.
It's definitely a lifelong, it's a lifelong adaptation for the family. And then you try to help the child to navigate adult life. She's at college right now doing just that. So it's very fascinating to me to know that it becomes important from the moment the baby passes the birth canal, and continues through the trajectory of life. So it's fascinating. So pediatricians are seeing lots of cases of eczema, other skin conditions caused by allergies. That kids are having these inflamed spots on their skin that sort of can induce sometimes anxiety, not only for the patient but also for the parent, because they're helping their kid to struggle through some of the challenges of feeling like you've got your skin is just not what their other peers have. Can you talk a little bit about your familiarity with clinical studies and research relevant to allergies and eczema?
Yeah, so the data is very compelling for Lactobacillus rhamnosus HN001, and reducing the incidence of eczema and allergic sensitization. And what's interesting is with that probiotic, other probiotics have been studied and have not shown an effect. So we do know that probiotics matter, the strain matters on the performance, and even the genus and species, others have been studied and have not shown an effect. So this is very interesting. The studies, which are all published, were provided HN001 during pregnancy, and then this continued 6 months post-term, so during that breastfeeding phase, and then continued at the same dose for infants at birth through to their second birthday. So it's long-term intervention. They were followed at 2, 4, 6, and 11 years. So that's 10 years worth of data showing this reduction in the incidence of eczema, which is quite significant, and the reduction in allergic sensitization. So very exciting data. And there's additional data on immune markers, transferring those immune markers in both adults and children. So, and also modulation of the microbiota. So it's not limited to pregnancy and lactation, but to have clinical data showing efficacy during this very special life stage of pregnancy is really quite powerful, very exciting.
So yes, this is one of my most fascinating studies in my work with How Are You, to research and read all of the details and the longevity of the study and how much data they have in following the kids for such a long period of time. So that study, we can make that study available if you're interested. So based on this very science, I know that Upspring created a prenatal probiotic called Dual Prenatal Immunity. And I would just love to hear more about the efficacy of the supplement, the safety aspect during pregnancy, and how does it play a vital role in the immune support for mom and the prenatal programming for the baby. So talk a little bit about the supplement and the efficacy. Tell me about safety, and then tell me how it also helps with the programming for baby.
Sure. So Upspring translated the science, so we're very excited, into a product that has benefit for mom to benefit baby. And it's the exact same genus, species, strain, and dose that was clinically studied for, and we have that long-term efficacy data. And, it's so exciting that this prenatal programming that you mentioned, right, to have long term data so that we really can see what's going on in children. And we also have other data to show us that what's going on with mom's microbiome really does affect offspring into their adulthood. So we really mirrored exactly what the science says. We don't have additional strains or probiotics in there. And this is designed also to be taken safely with your prenatal vitamin, which is very important. So we have really solid safety data on the Lactobacillus rhamnosus HN001. And here's the difference. We've got the efficacy, we've got the known benefit, and that's what Upspring brought to the market. Both the known safety and the known benefit, because it's been clinically studied during this very specialized time of both pregnancy, lactation, and of course, among infants as well. So infants can also take this probiotic.
So for all of the pediatricians, OBGYNs that we might have in the audience today, even family doctors, it's so comforting for me to hear, and I'm sure for many of you it may be as well, that you could have confidence in prescribing dual prenatal immunity to safely to your patients as expectant mothers. So I think that's fascinating, reassuring, the innovation that we have in the industry for this strain. So we talk about pre-birth, let's talk about post-birth. So those crucial days and weeks after the baby begins their journey, mom begins recovery. Can you share some of the health benefits of your dual postnatal immunity?
Yeah, so dual postnatal immunity continues to support mom's immunity along with the transfer of antibodies. We know we're encouraging her to breastfeed, to transfer that IgA antibody proteins for the long term health. The secondary findings of the study were a reduction in postpartum depression and anxiety scores. This is very important for mom, right? So we want to continue to support that. And we've added 3 key B vitamins to the formula to continue to support that vitality, mood, and energy. This is also a time where there's hair loss, there's hormonal changes. So these B vitamins are there to also support hair and nails. So we're very excited about this product as well.
I think it's awesome to know that I didn't know that these things were available to me when I was a mom 18 years ago. So I think it's great. We don't get enough supplementation from our food. We don't know in a sea of products what is good for us, what's safe, what's actually going to work. So I think it's great that you have science-backed quality products with awesome ingredients that that will sustain the health and wellness of mom and baby, and just take that. It's one less thing to think about, right, for your family as mom is having a new baby. So I think that's fantastic. So talk to me about how do we get these products? So how can HCPs find Upspring products in retail and e-commerce?
So it's very easy. So Upspring Dual Prenatal and Postnatal Immunity products can be purchased on Amazon, and they can also be purchased at myupspring.com. So very simple.
That's great. So we've got the ease in obtaining the products for your patients, and I assume that your team would be readily available to speak with any HCPs that had any further questions or wanted more information about your products. Yes.
Absolutely. We'd be happy to.
Wonderful. Well, I think in an ever evolving landscape that we have been seeing in the dietary supplement space and health and wellness in general, I'm really excited to hear all of the innovative things that are going on at Upspring. And we're really excited that you are a partner of How Are You, and that you're bringing all of this to life for the health and wellness space. So thank you for sharing your insight with us today, and for you and your team and all the work that you're doing to change the face of health and wellness at Upspring. So we appreciate you being with us today.
Thank you, Tina.
You're welcome.